What's going on, guys? Of course, this is your boy B, and welcome to another show, the Grooming Den Show. We have a special guest this evening. She goes by the name of Dr. Meena Singh. She is a board-certified dermatologist and dermatologic surgeon, and also specializes in hair loss. So, with that said, I would like to introduce you guys Dr. Meena Singh. Welcome, Dr. Meena Singh.
Thank you. Thanks for having me.
How are you holding up during these times?
Luckily, I live in the suburbs, so I feel very lucky because my lifestyle hasn't changed horribly, because most of the time I would just be going to work and then hanging out with the kids and taking them to their stuff. So besides the kids not being in school, I'm basically still going to work and hanging out with the kids. So it's nice. We go out every day and just enjoy. It's been such nice weather compared to usual. So we've just been enjoying the outdoors and working as much as I can, trying to make the most of it. So it hasn't been horribly different than my normal life. So I'm very lucky in that way.
Awesome. Yeah. Same here. I'm typically inside for the most part, but so
yeah.
Changed. Well, let's go ahead and get into some questions. Again, I want to say thank you for your time.
Yeah, thanks for having me.
Definitely. And we created the Grooming Den Show, and the idea was to bring more awareness around the education of hair loss, men's skincare, men's beard care, and typically in our community.
Yeah, I love that.
Yeah, typically in our we got toast. We got toast.
Oh yeah, listen, I was starting my thing anyway. Toast.
Let's go toast.
Here we go. Cheers.
Cheers.
This is golden milk. It's very good.
You have golden milk?
Mm-hmm.
Okay. I have ashwagandha tea.
Love. Both are anti-inflammatory, good for immune system.
Mm-hmm.
Wonderful.
My favorite. So we started the Grooming Den Show, and to bring on experts like yourself, people who are actually in the field. This is what they study. This is what they do. This is what they live. They're helping people, not only in their community, but around the world as well. And so we just wanted to create a platform to bring in, to bring awareness around these particular type of topics that we're so lost in what's going on in the minutia. Like somebody's saying this,
right,
saying that. And then once you got so many different types of messages coming your way and you're already not in the know, then it can get truly frustrating, especially when it comes to hair loss. You're thinking like, all right, I'm just going to give it up, throw in the towel, and just call it what it is, right?
I agree.
So speaking to hair loss, would you mind kind of giving us a brief understanding for some of our individuals in the audience, what is androgenic alopecia?
Sure. So androgenic alopecia is the medical term for, and I know most of your audience is men, correct?
Yes.
Okay, so it's the medical term for patterned hair loss. You can have male pattern hair loss and female pattern hair loss, but we'll focus on the male pattern hair loss. So male pattern hair loss, like it states, is patterned. So androgenic alopecia is another term for that. It's where the hairline slowly recedes. It usually starts at what we call the temporal vertices, and it slowly creeps back. The temporal hair points creep back over time, and then the vertex or the crown of the scalp gets more and more see-through, and it opens and gets wider and wider. So it's a staged process where it happens really slowly. Your hair cycles every 2 to 6 years, depending on your genetics and other factors. And so every time your hair is cycling, once this starts occurring, your hair cycles in thinner and thinner and thinner until it doesn't cycle in anymore. Once it doesn't cycle in anymore, then it becomes permanent, irreversible hair loss. So what causes that is in certain areas, usually the areas that are patterned, you have more receptors for testosterone. Okay, so in individuals that have this, it's usually a genetic predisposition where you have more receptors for testosterone in these areas compared to areas that are unaffected. Not only do you have more receptors for testosterone, you also have greater affinity for binding. And so what occurs is you have these cells around your hair bulb that start to diminish. Those cells are what create normal hairs and normal hair cycling. So the fewer of those cells that you have, the thinner your hairs are. Once those cells are gone, you have no more hair. So that's what's actually occurring when you start to lose your hair. The main point with this is that it's a chronic condition, but it's treatable. And so if you start treating it early, you do not have to necessarily go bald, right? So I think a lot of people are taught that, you know, I'm balding, now what am I going to do? You know, so if you can catch it early, you can treat it. You can prevent ongoing hair loss, and you can actually rethicken the hair. Wow. Depending on if you catch it earlier. Mm-hmm.
That's such a relief for a lot of guys, because I know, as you know, that the first thing they're thinking, like, oh man, I'm balding. It is finished. I'm done. No more barbershops. No more Caesars. No more braid. Nothing. I'm done. I'm in this other group, this other category. So I know that's a huge relief.
Right.
Now, when you talk about you have to catch it early, what does that mean?
If you want to have the best cosmetic outcome. Okay, so recognize that your hair is thinning early is the best way to go about it. So I usually rely on the patient or their barber, because their barber is going to be their primary care provider basically for their hair. They're the ones that see things early, right? A lot of times I work with barbers a lot, especially I'm in Kansas City. So in my community, I'm very close with all of the big barbers here, because we do a lot of education with their clients and my patients. And we work together because they're the ones to recognize things first. And so if they're educated on what to look for, then they can recognize it and then send them to me so that we can start treating them as soon as possible. Because a lot of times what occurs is as the men's hairline is receding, they'll just push their fade back, right? Or they'll put powder in and just fill in the hairline, but they're not doing anything to address the hairline receding or prevent it from getting worse, right? And so if we have good education and can recognize it early, we can prevent that from getting worse instead of just pushing the hairline further and further back with our haircuts or filling it in with powder.
And what would you say to a barber if,
Uh-huh.
I'm a barber, I'm not a barber, but if I was a barber and I have clients, they're balding, I don't even know how to have that conversation with them, right? Because it really has an impact on our psychological health. What would you say to me and how to help?
Well, I actually, so it's twofold. I speak to my patients and I say, hey, who's your barber? And they'll tell me, and I say, hey, did they happen to mention that you were experiencing this, or did they happen to note this? And if they say no, and I would say, so next time when you go to them, tell your barber that if they see any of their other clients presenting with these particular features, that they should see someone, a dermatologist or someone like myself, to address it. So I speak to the patient and have them reach out personally to the barber and say, hey, if you see this again, try to tell someone sooner. And, you know, a lot of times some people feel like they might be causing it, you know, incorrectly. And so they might just not say anything, but that would be the wrong thing to do. And then when I give workshops with the barbers, I show pictures of hair loss, what to look for and what to expect. So what to look for is what we call miniaturization. And so that is noticing. So, okay, everyone's hair follicles should be the same thickness, right? If you look through people's scalps, each hair follicle should be the same thickness. If you're starting to have variations of thickness, where some follicles are thinner, some are thick, some are missing, meaning there is a hair follicle opening, but the hairs aren't in there, that is called miniaturization. And that is a sign that this person is experiencing early stages of pattern hair loss. So those are the things you can kind of look for. And that I think it is the job of anyone that's doing hair, cutting hair, to be at least mildly educated about what to look for and what to recognize. That way you can send their clients to the proper outlets to get it addressed.
Yeah, I'm so happy that you share that part, because that we work with a lot of barbers, and in terms of just you know, we have different grooming products, so we do a lot of things here in Atlanta, Georgia, and some barbers I know, they're like, man, when I have reference or said something to my client, they get upset. It's a very sensitive topic. Like, how do you overcome that?
Okay, so they've done their job at that point, right? So their job is to just state, hey, I'm noticing these changes on your scalp. If the person is not receptive to that, then they've done their job, right? So I think it's worse to just not say anything. So I have a lot of patients whose hairstylists or barbers have clearly known that something's going on, right? Like, for example, if someone's getting their hair locked every couple weeks, right? Or every 6 to 8 weeks, and the space between the locks is getting wider and wider and wider, and they don't mention that, you can't see the top of your scalp, right? You're relying on that person to give you that information. If they don't mention it, then they're doing more of a disservice than saying, hey, I noticed that you're thinning in these areas. Do you want to address it? And if they're like, listen, I don't care, like, you know, ladies love me anyway, then fine. That's on them, you know?
Okay. Now, now that we stand on the topic of hair loss, how
Sure.
come, I don't, and let me know if you're seeing this, but
Mm-hmm.
what I've noticed, especially on social media, I get a lot of young men who are like, hey, B, my hair is thinning, what should I do? Right? They're looking for some direction.
Mm-hmm.
All of a sudden, there's a large case of young men losing their hair when the idea was, oh no, you start losing your hair as you get older.
Sure. Okay, so that both are correct. Just when you're older, there's a greater percentage of men that have hair loss, right? So when you're younger, it can happen at any age. It happens, you know, it can happen 16, 17, right? It just depends on your genetics. There's environmental factors and systemic factors as well on top of the genetics, but mainly genetics. And there are fewer percentage of men that have hair loss at that age, but it definitely can happen at a younger age. As you get older, there's just a greater percentage, right? So at about 50% of men will have some form of hair loss. Mm-hmm. I think the other thing too is there's just more wider recognition of most issues, right? Because we have social media. So, you know, skincare, hair care, you know, do-it-yourself videos, DIYs, that wasn't a thing growing up, right? Also, I think it depends on culture. So I know, you know, I grew up in the 90s, having the hair, the Michael Jordan, you know, the bald head, that was sexy. That's what everyone was doing, right? And so it didn't matter if you're losing your hair, you just shave it, you know? That is a look, right? It was like the bald head with the goatee, that was everything. You didn't need hair, right? So it goes in waves as far as pop culture and what's fashionable. And I think now there have been studies that have shown that men who wear their hair bald, like smooth bald, you can't tell that they're thinning, versus men who have hair loss or who are thinning, they look more powerful in a boardroom setting or in a business setting, right? They command a better presence than someone whose hair is thinning, right? So you just have to make a choice. Do you want to just shave your head bald, or do you want to commit to the process of treating your hair loss? Because it is a commitment. It's a chronic condition. So it's just like having high blood pressure, for example. So with high blood pressure, there is no cure for high blood pressure. Someone that has high blood pressure will always be predisposed to that. But you can treat it, you can change your lifestyle, you can take medications. But as soon as you stop doing those things, like if you stop doing the certain medication or stop doing those lifestyle changes, you'll still have high blood pressure. You haven't changed anything, right? It's the same thing with hair loss. Your hairs will always want to thin if that's the path that they're starting to take. You have to like constantly remind it not to do that. And that's by taking medications or doing treatments to prevent it from thinning. So it's a commitment. And our hair cycles are so long, it usually takes 8 to 9 months before you can tell if anything's working. So that's a hard commitment, right? You're doing something every single day. You don't feel a difference. You don't see a difference. It's not an immediate reward or immediate response. So it's tricky, and it takes a lot of hand holding, but that's why it behooves people that are really interested in keeping their hair to speak to someone that specializes in that. And I think for men, you don't really have much, right? Now everyone does the beards, right? It's not like you can do makeup. You know, like as women, we can do this drag queen makeup where we can look like a completely different person just by painting our face on, or we can change our hair overnight, right? And look like a completely different person. Men, you don't really have much in order to enhance your cosmetic features, right? You have your clothes, your facial hair, and the scalp hair, right? So it would behoove you that if that is important to you, to try to keep as much hair as possible, right? So you have more options in the future. Some people, you know, I get these younger patients who are like, when I'm your age, I'm not going to care anyway. And I'm like, first of all, 40 something is the new 20 something. Like it, you know, like you'd be surprised how much you do care when you're older, you know?
Yeah, no, absolutely. Now you said a couple things there. You said that the time is follicles, right? The sooner you can get on top of the hair loss you're experiencing, thinning, the better, right? So there is, it's treatable, right? The sooner the better. And then the other part, you said that it's environmental. So you have to, if you have high blood pressure, then there's things you just can't eat, right? There's a lifestyle that you must be committed to live up.
Yeah. So let me speak on a couple things. So to go back to what you're saying, it's a lot easier to keep the hair you do have than try to grow hair back. That's just the general rule, right? So that process is a lot easier. So that's why catching it early makes sense. Also, with most conditions, there are usually 3 things that are in place. Genetics, right? Our genetics plays a huge role. So for hair loss, if you had a twin, for example, there's only an 88% concordance rate with hair loss in general, meaning that if you have a twin that has the exact same genetics as you, it's only 88% as likely, that they would have the same conditions, because environmental and systemic factors play a role. So for example, environment means like maybe you're in a stressful relationship, or maybe, you lost your job, right? So your environment is such that it makes it so you are having like an inciting factor, inciting stressor that might make your hair cycle worse. The systemic factors that can play a role in hair cycling are many. So thyroid definitely plays a role. Iron deficiency can make your hair cycle abnormally. Any hormone changes, so that's any hormone changes, okay? And for women, that tends to be having a baby, starting or stopping birth control, starting menopause. And then any medication changes. So we talked about high blood pressure. Some of those medications can make your hair shed more, which can further unmask hair loss.
Okay. All right. Now, just for a lot of my brothers out there, when you say that hair loss is genetics, you're not are you sharing that it's genetics, but it doesn't necessarily mean that it has to be that way? If
you have male pattern hair loss, there's probably someone in your family. It may not be your father, it may not be your brothers, but someone in your family probably has that, because you have to have the genetic predisposition to have that testosterone interaction on the scalp. Because in men, the testosterone interaction is exactly what causes their hair loss.
Right. Now, does that mean that if someone is predisposed to hair loss and that they can stay mindful, right, living in terms of the best quality life that they possibly can live, they can manage that, versus if someone, let's say, drank a liter of alcohol every single day and ate nothing but just a whole bunch of processed sugars, right? Like, these are 2 different people, but they are both predisposed to hair loss. How would that how would that would make a huge impact on one from the other person when they're
right. And that's why, so exactly. So that's why with twins, it's only like an 88% concordance rate, because there are other factors. So another factor, speaking about sugars, is diabetes, right? So diabetes, as we know, what happens is you're attaching sugars to a lot of your cells, a lot of your tissues, and they're not functioning properly. So what occurs with hair, the way it grows is, as I mentioned, you have these cells that live under your hair bulb. Those are called dermopapillary cells. You need those cells to form the hair shaft or the hair follicle. Those cells migrate to form that. Okay, if you have diabetes, you are attaching sugars to those cells, and they don't migrate, or they don't mobilize as quickly as they would in someone who didn't have diabetes, right? So if you had a twin with diabetes that had a predisposition for hair loss versus the twin without diabetes, the twin with diabetes probably would have worsened hair loss than the twin without it.
Okay. Awesome. Let's go ahead and get to some questions real fast.
Sure.
Here. I appreciate you. Thank you for sharing that information. This question is from Esquire82, and his question is, this is from his Instagram account. His question is, should he trim his thinning hair when he gets a haircut, and if so, how often?
So trimming your hair wouldn't affect the rate of hair growth.
Okay.
Right. Okay, so for example, just look at my hair right now, okay? If I trim it, it's not going to make the hair at the root grow any faster. So if you want it to be present, then I wouldn't treat it any differently than the remaining hair. The one thing you don't want to do is take already fragile hairs and further traumatize them. So a lot of men that have thinning hairs might wear hats, for example, right? So like you wear a hat and it rubs on the temples. And so this is where men tend to lose their hair more anyway. Yep. And so that might further compound the already thinning hairs, but trimming your hair won't make a difference, right? We do know that plucked hairs, when they regrow back, they regrow back at a faster rate, right? So say you like literally pluck a hair out of your head, it will grow back faster than your normal hairs.
Really?
But trimming it does not make a difference. And plucking it comes from the root.
Got it.
But I'm not saying pluck your hair. I'm just saying that trimming doesn't make a difference, but plucked hairs does. You know, right. And then if you keep doing it over time, the hair won't grow back.
Okay, awesome. Another question was, this is from Mazzy233. His question is, he keeps losing his hair. He's receding, and he's trying to figure out what he should do. What would be the next best steps for him now that he's noticed that his hairline is starting to recede?
Yeah, I always recommend getting an evaluation from a dermatologist. It takes a while to get into a specialist for hair loss. And so the first thing he can do is just take over-the-counter Rogaine. It's over-the-counter. You can get it anywhere. It's a topical foam that directly stimulates ongoing hair growth, right? It also slows down the rate of hair loss in 88 to 90% of men. It may not completely stop the rate, but it will slow down. So if you start taking topical Rogaine right now, say like in a year, you will have at least more hair than if you hadn't, because as I mentioned, hair loss is progressive. But you need an evaluation from someone, because especially in Black men, male pattern hair loss is not the only cause of hair loss. There are other forms of hair loss that mimic male pattern hair loss. Okay, these are scarring forms of hair loss that are quite common, and they can look very similar to male pattern hair loss, but they are not. And just doing something like over-the-counter Rogaine would not prevent further hair loss with that. Typically with the scarring form of hair loss, it looks like thinning in the crown. Sometimes men will complain that it started off with some burning or itching or some sores in the scalp, and they'll complain because they think that maybe their barber used dirty clippers. That is not the case. And eventually the hair loss will get worse. It's not a fungus, it's not a bacteria, but it's a form of hair loss that mimics male pattern hair loss, which is why it's important to get a workup and get it addressed so that you know that you're treating the right condition.
Okay. One last question, and I know we're gonna end with this. This is from Marley. This is from _Marley Mar from Instagram. His question is, what is the fastest way to improve thinning? Well,
okay, so the fastest way is to do multi-modality treatment. So I would not just do Rogaine, right? I would do everything, if you wanted to come back as quickly as possible, that addresses the cause of hair loss. So I'm assuming we're just talking about male pattern hair loss, because yes, again, there are multiple forms of hair loss. So if we're just treating male pattern hair loss, I would at least do a form of minoxidil. So we have Rogaine as a topical foam, but then we also have oral minoxidil, which is a pill. Okay, oral minoxidil bypasses the problem of absorption. So when you apply topical foam to your scalp, you're just hoping it gets absorbed into the scalp and that you're not preventing it from working by having problems with absorption. The oral minoxidil goes into your system, so it goes directly into the bloodstream and feeds the follicles that way. I would also do something called either finasteride or Propecia that blocks the hormonal influence of the hair loss. So we mentioned that testosterone plays a role in thinning. Testosterone has a more potent form, which is called dihydrotestosterone. Dihydrotestosterone is what really is acting around the hair follicle. So finasteride blocks the conversion of testosterone to dihydrotestosterone. Many people call it DHT. I don't know if you guys have heard about DHT blockers, that kind of thing. So finasteride would be considered a DHT blocker. So if you do something like a DHT blocker with something that directly stimulates the hair growth, such as minoxidil, you're going to get a better result because they act synergistically, because they have different mechanisms of action. They're addressing different problems. Lastly, I would do something that directly stimulates those cells that are diminishing that we talked about, those dermal papillar cells that are literally leading to you having thinner hairs. You can directly stimulate or signal those cells to re-amplify and grow again. So those therapies are bioactive therapies. So there are some called platelet-rich plasma. I don't know if you guys are familiar with that. That's where we take and extract your plasma platelets, hyperconcentrate them, activate them, and inject them into the scalp. They release growth factors. So it's like a growth factor therapy. They directly signal those cells to re-amplify and grow again. There's also exosome therapies. Exosomes are packaged somewhat like what's in stem cells to directly stimulate those cells as well. I also recommend, so another thing that you can do over the counter is microneedling, okay? So there have been studies that show that if you microneedle, I don't know if you guys have heard of those germ rollers, but they're basically these little torture-looking devices. They're rollers with little spikes on the end. So you roll it on the scalp. What it does is it increases the absorption of Rogaine or minoxidil, and it also will help stimulate the scalp. So there have been studies that show that if you do Rogaine with the derm roller of their microneedlers versus Rogaine alone, you'll get a better response with the Rogaine and the microneedling. And that's easy. You can order that on Amazon. So you can start with those kind of things. But if you want the fastest results, I recommend targeting from all angles. And so, like I said, it's a commitment. If you really are trying to save those hairs, you can do all of those things. Some people will also take supplements. So the supplements, those are mainly to just help with the building blocks of the hair to make sure that your hair is cycling as well as possible. We talked about some of the systemic and environmental factors. Many of these supplements address those factors.
Wow. We have, this topic is so deep and so wide. We don't even have enough time, right? And
we can talk about this forever. Yeah.
Ever. And I love this. And I know you have somewhere to be. So I want to respect your time. Gentlemen, ladies, there you have it. Dr. Meena Singh. She is a board certified dermatologist. She specializes in hair, obviously, right? I mean, she does this in her sleep. So if you have any questions, I will have in the description, I will have her information where you can contact her. Are you doing any virtual appointments?
I am. I'm doing a ton, actually. So you can just DM me on Instagram or go to, I'm at KMC Dermatology. You can go to that page. KMCdermatology.com. And then you can actually make appointments through there. But yeah, I'm doing a lot of virtual visits. So
awesome. Well, we definitely have that in the description. If you're on IG, then you can go ahead and follow her on IG. We have it right there in our post. And then if you're on YouTube, we have it in the description. And if you're on Facebook, we're going to have it as well on our, we actually have it on our Facebook page as well too. So, and she is on Facebook, so you can follow her on Facebook as well. So again, thank you so much. I appreciate that.
You're welcome.
And I definitely would like to have you on the show next time when time permits. Is that okay?
That would be great. I would love to be back. Thank you so much for having me.
Thank you so much. Talk to you soon.
All right. Take care.
Bye-bye.